6:14, our back-to-school coverage continues this morning as we talk about how to keep your child healthy this school year. New data from the CDC shows childhood vaccination rates have fallen again in the United States. 92.5% of kindergartners got the measles-mumps-rubella shot. That's the MMR last school year, down again from the previous year. Before the pandemic, the rate was 95%, and that is the level necessary to maintain herd immunity. The American Academy of Pediatrics has reiterated support of requirements that children be immunized to go to school or daycare. Medical experts I talked with explain why your back-to-school routine should include routine vaccines. What's the best advice on vaccinating your children?
The vaccines are much safer than the actual disease.
A response you'd expect from emergency medicine expert Dr. Mike Patrick from Nationwide Children's Hospital. It is one shared by his medical colleagues, including Dr. Chelsea Moreland from the Columbus Medical Association and experts from the American Academy of Family Physicians. Vaccines are safe and effective.
We continually review vaccines. And yes, for example, the DTaP vaccine, the one we use for tetanus and whooping cough that is being given now is not the same one as was given 50 years ago. So yes, vaccines are continuously reviewed and continuously updated. That doesn't mean that we need to start with a blank sheet of paper, stop vaccinating everyone.
It is critically important that we are arming our students to be able to be healthy and be in class. They can't learn if they're absent because they're sick.
Ohio law requires students to be fully protected against these 10 vaccine-preventable diseases. The diseases are vaccine preventable. Vaccinations are, in some cases, combined, including the MMR, which covers measles, mumps, and rubella. Medical experts are stepping up their push in the wake of the resurgence of measles to remind families to block out misinformation and turn to their trusted medical providers.
So if a parent is trying to decide what to do with all that information, my first recommendation would be to turn to your physicians, your doctors, your nurse practitioners, all the members of your healthcare team, because they have had the training and the experience, and they have seen what happens when the vaccines are not given and when the disease is prevalent again.
And students must provide proof of immunization or have an exemption on file within 14 days of starting school. You can go to our website, 10tv.com, for a link to the Ohio Immunization Summary for school attendance for this school year. You can also find exemption information at the Ohio Department of Health's website.